Hello everyone, this is Dr. Creel's online class and welcome to my class. And this is purely intended to nursing students and registered nurses. Okay, so I'm sorry kung may maririnig kayong noise kasi nasa labas po ako. Ginamit ko lang po yung time para maging productive naman yung time ko, so gumawa ko ng video na to. Okay, and for today, I am about to discuss the gastrointestinal assessment. Okay, so through nursing history and physical assessment. Okay, and disclaimer lang po, the content of this discussion was taken from the series of different authors of MS books, and pictures and the videos was taken from the Google. Okay, so class, set back, relax, and learn from the discussion. And if you find it informative, do like, share, and subscribe to my class for you to be updated for the coming discussion. Okay, so here, can start now. In the nursing history taking, the very first to ask is the chief complaint. Okay, so what are the chief complaint of the patient with a GI problem? Mostly, they can report if there are changes in appetite. Change in appetite. What else? Uh, like heartburn. Okay, and maybe the patient is nauseated. What else? If there's pain and vomiting. Okay, and also the patient may also report a change in bowel habits. Okay, like what? Like constipation, diarrhea, or merong mga characteristics yung nagkakaroon ng different stool characteristics. Okay, watery na ba siya or really that hard, right? So that's it. For the present illness, so you can ask the patient with the symptoms that includes when started. Okay, what are the associated symptoms? What else? If there is pain, where is the location? If there is radiating pain, and what is the intensity? What else? The duration of pain and the frequency, right? Kailangan natin to. And of course, if there are elevating factors or precipitating factors. In class, do not forget to ask also if the patient is using a prescription or over-the-counter drugs. Okay? If the patient also is taking any herbal medications or herbal remedies. If the patient is taking vitamins or any nutritional supplements. Okay? And you can ask also the patient if she is using laxative. Right? Lalo na kung nagtatay, common, laxative agad, di ba? If the patient's chief complaint is diarrhea, find out if he recently traveled abroad. Right? And what else in the present illness? Ask the patient about changes in appetite and in bowel habits. For example, change in the amount, the appearance, or color in the stool, or the appearance of the blood in it, if there is. And kung meron bang difficulty in eating or difficulty in swallowing. Okay? So those informations are necessary in taking the present illness. The next is the medical history. In here, we can ask the patient other GI disorders. Okay, such as what? Gallbladder disease, GI bleeding, kung meron bang inflammatory bowel disease or ulcers. You can ask also the patient if there is a previous abdominal surgery or trauma. Okay? Then, family history. For the family history, you can ask the patient if there are hereditary link such as alcoholism, colon cancer, Crohn's disease, stomach ulcers, or any ulcerative disorders, or we also have ulcerative colitis, right? Also ask the patient about the family history of chronic diseases kung meron sila. Okay? And what else? For the social history. Okay, for the social history, ask about the work. Saan ba siya nagtatrabaho? Diet. What else? Use of recreational drugs, right? If the patient is fond of taking alcohol, right? Ano pa? Caffeine, masarap to eh. Sarap. Diba? Caffeine intake. Ilang beses ba siya umiinom ng kape sa isang araw? And what are the hobbies of your patient? And also, do not forget to ask the patient about stress. Okay? What are the support system and the coping mechanisms of the patient? So, class, if you have any question, you can write your questions in the comment section. Then I will answer it later. Okay, so um, for the physical assessment, when assessing the abdomen, use the sequence, inspection, auscultation, percussion, and palpation. Ito po yung tamang way in assessing the patient. Why? Because percussion and palpation in the abdomen before you auscultate can change the characteristics of the patient's bowel sound and may lead to an inaccurate assessment. Kaya dapat inspection, inspection, auscultation, percussion, and palpation. Okay, so let's start. So the nurse begins with inspection. What to observe in here? We need to observe the patient's general appearance. Okay? At notice natin yung behavior ni patient. Inspect the skin for turgor, color, texture. And we need also to note abnormalities such as bruising, decreased axillary or pubic hair, if there are edema, petechiae, scars, ano pa, spider angiomas, and stretch marks. We need also to inspect or observe the patient's head. Ano dito sa head na patient? The color of the sclera, sunken eyes, denture caries kung meron, lesions, breath odors, and tongue color, swelling, or dryness. Okay? And of course, we need to check the size and shape of the abdomen. Okay? We need to note if there are distension, peristalsis, palpation, contour, visible masses, and protrusion. And of course, never forget, observe the rectal area for abnormalities, right? Lalo na kung the patient is experiencing diarrhea. Okay, auscultation. Wow, ganda ng picture natin, no? The nurse continues by using auscultation. So we need to note the character and quality of the vowel sounds in each quadrant. Okay? So auscultate the abdomen for vascular sounds. Maybe for the next videos, yung mga topic naman natin is yung mga sounds, vascular sounds. Okay? Isali na natin yung mga abdominal, yun nga, abdominal sounds, heart sound, lung sound, ganyan. Okay? And next is percussion. Percussion, percuss the abdomen to detect the size and location of the abdominal organs. And we need to note the presence of air or fluid. So this is the proper way of doing the percussion. So same pattern pa din, sundan lang natin to. Here, pataas. Ganyan. Okay? And palpation. For the palpation, this is the last one. Palpate the abdomen. Ito din yung pattern niya. Ito. Okay. So, palpate the abdomen to determine the size, shape, ano pa, position of the organs, and if there are tenderness of the major abdominal organs, and to detect masses and fluid accumulation. And we need also to palpate the rectum, and we need to note any abnormalities. Okay? So class, if you have any question, do not forget to ask. Do not forget to write your questions in the comment section. And wow, so I am about to end the discussion with a simple note saying, be informed, be knowledgeable. And again, if you find it informative, to share, like, and of course, subscribe to my class. Okay? For you to be updated for the coming discussions. Okay? You may add your comment, your suggestions, reactions, clarifications, and if you want some topic to be discussed, you can write it in the comment section. So thank you for listening and bye-bye for now.